And thank you, Dr. Deepesh.
Thank you so much. Good morning, all. Today we are going to discuss about elbow pain, the condition of elbow joint, the articulation of the elbow joint, the condition which arises from the elbow joint, the condition in which elbow joint get detached to the its content and area of the articulation. First of all, we have to understand that what is exact elbow joint and what are the articulation and what are the types of pain are in elbow joint. There are so many terms including tennis elbow, golfer's elbow, bicipital tendinitis, normal muscular pain of elbow, stiff elbow, or post fracture pain of elbow. But few are very important in our day-to-day life, which is tennis elbow and golfer's elbow, including all sports medicine topics. Today we will discuss all types of pain of the elbow, including the regime of exercise plus home regime to treat the elbow pain. First, we have to understand that what is the elbow joint and what are the articulation between the elbow bones. There are basically three bones. Two are forearm bones, and one is the bone which arises from the shoulder joint. This is the first bone, and the two bones arises from the articulation of the elbow joint. Elbow joint is having a special movement of supination and pronation, which we can say key movement. When we put a key in lock, we have to move our hand like this. This movement is also related to the elbow joint. So first we have to understand the movement of the elbow joint. The main major movement of the elbow joint is key movement, which we can say supination and pronation, up front and back front of the elbow area. Second is flexion and extension. Flexion means we have to flex the elbow, and extension. These are the two basic movement of the elbows. Now, in elbow joint, we have so many problems related to our day-to-day activities. First and very important is tennis elbow. What is tennis elbow exactly? I'll show you a diagram in which we have differentiate all the pain of the elbow in different colors. You can understand from this that what type of pain you may have. For that, first we have to see that photo in which elbow is divided into A, B, C, D, E, F, G. A is bicipital tendinitis, B is hyperextended elbow synovitis. Elbow synovitis is a condition in which synovial fluid of the elbow joint get dense, it get inflamed, due to which the movement of the elbow joint get painful. Third is golfer's elbow. C, D is cubital tunnel syndrome. It is related to the neural problems. E is triceps tendinitis. F is MCL sprain, and G is elbow epicondylitis, in which elbow tendinitis and the condition which is related to the elbow joint pain we will discuss in a separate way. First, we have to understand that where is the exact points of the tennis elbow and golfer's elbow pain arises. First, we have to see our elbow. This outer compartment pain, and this is the inner compartment pain. And this is middle or center compartment pain. This outer compartment pain and the point which arises exact joint pain is known as tennis elbow. The outer compartment, the compartment which is outer. If you see like this, we can judge the area of the pain. This area is outer area, this is inner area, and this is central area. In this outer area, we will see the bone of outside is related to the tennis elbow pathology. In this tennis elbow pathology, it is tennis elbow, or it is also known as lateral epicondylitis. Itis means inflammation. Inflammation of the outer compartment of the elbow is known as tennis elbow. And the golfer's elbow is inside. Golfer's elbow is inside. The internal condyle inflammation is known as golfer's elbow. In these two types of muscular pain, in these two types of the pain of the condyles, we can see the weakness of extensor compartment. You cannot hold anything, you cannot squeeze anything, you cannot mash anything with the hands, you cannot squeeze in a proper way. You can do squeezing from one side only because you're having pain on left side, so you can not squeeze according to the rotation. So this squeezing movement and this gripping movement also get hampered due to the elbow pain, especially tennis elbow and golfer's elbow. Sometimes some people have pain in the center compartment and they say that we are having tennis elbow or golfer's elbow. So the compartment which arises in the center of the elbow is not related to the tennis elbow or the golfer's elbow. It is only and the only biceps tendonitis, the tendon which arises from your bicep muscle or its normal bicep muscle pain. In the normal bicep muscle pain, we have so many remedies to control the pain, including restriction of the movement. So, if we talk about the protocol of the pain management, if we talk about the protocol of the complete cure of the elbow pain, for that we have to check the temperature of that point. We have divided mainly three conditions of the elbow. First is tennis elbow, second is golfer's elbow, and third one is biceps tendinosis or biceps tendonitis. I'll show you the picture in which we have divided three things mainly. Forearm extensor pain is tennis elbow. Next is golfer's elbow, and biceps tendon pain is in the center. We have divided mainly three major parts of the elbow pain. It is in back area also and front area also. Extensor pain is related to the tennis elbow, and the biceps tendon pain which arises in the central area, and the forearm pain, forearm lateral side or outer side pain, inner side pain, which you can say is a golfer elbow. We have denoted this with the red markings due to the inflammatory response. It is an inflammatory pain of the body, inflammatory response of the body towards the pain. That is why we say it is epicondylitis or the condition related to the inflammation. Now, main major things in the elbow pain, in general elbow pain, first we have to differentiate the type of pain. First we have to see the type of pain, that what type of pain joint with. Although we have made a universal protocol of the elbow joint pain, what are the common symptoms of the elbow pain and what the common presentation of the elbow pain, including these all pains, are morning stiffness of the elbow with persisting aching. It could be continuous or persisting tenderness on the outside of the elbow. It is basically related to the tennis elbow and applies to the golfer's elbow also. In tennis elbow, it is outer side of the elbow, and in golfer's elbow, it is inside of the elbow. Soreness of the forearm muscles, forearm muscle also gets sore because forearm muscle arises from this is basically related to the tennis elbow and golfer's elbow, morning stiffness of the elbow with persisting aching, tenderness on the outside of the elbow. Of the elbow is related to the tennis elbow, and inside of the elbow is related to the golfer's elbow. Soreness of the forearm muscle also get so due to the movement of the joint. Because if we move the joint with the soreness, it get pain according to the compartment. According to the compartment area or the belly area of the muscle. Elbow pain when grasping or holding an object. If you object any glass or anything in hand like this, the pain will arise on that particular point. This is also a symptom of tennis elbow. Outer side is related to the tennis elbow and inside is related to the golfer's elbow. Now, what is the protocol of the exercise? What is the protocol of the complete cure of the extensor compartment pain? We have to understand that first. If we say that we are having elbow pain in center, in outside, in inside, in general, we are having pain overall the area of the elbow, means we could have normal elbow muscular pain or tennis elbow plus any type of muscular pain which is associating with the tennis elbow. Now, in this condition, we have to do icing first. We have to do ice fermentation first because these all conditions are related to the inflammation. After the assessment of the inflammation, after the assessment of the pain area, we have to check the tender points. We have to check the tender area. How can we check the tender area? First, we can see by gentle pressing inside of the elbow, outside of the elbow, or at the point of the epicondyle. We can see the pressure. We can see the warmth. We can just see the tenderness over that area on the surrounding of the elbow joint. This is tenderness of the elbow joint, which we can use to differentiate the pain of the elbow joint. After the checking the warmth, we can see the warmth, there is warmth or not, the temperature of the both the elbows are normal or not. We have to check like this in front compartment, inside compartment, in back compartment. After that, we will do icing to the elbow joint. First step is icing. We can use price theory in that pain also, but in that pain we have to see two or three things majorly. First is compression, second is compression with the icing, and third and main thing is elevation. If there is any point of swelling, if there is any pitting edema over that area of the elbow joint, for that we have to use some elevation of the elbow joint. Although elevation of the elbow joint is not that much indicated in normal cases, in grade 1 or grade 2 cases. So first we will do icing. After the icing, we can use normal compression or we can directly move to the exercise protocol. After the exercise protocol, we will move to the gentle massage or we can move to the normal stretch of that elbow joint. First, we see the elbow joint articulation exercises. In elbow joint articulation exercise, we will do all the normal movement of the elbow joint in a free manner. First, we have to do just normal warm up to the elbow joint. We have done icing over that area, outer compartment, inner compartment, and biceps area first. Second part, our grade 2 exercise regime is normal movement of the elbow joint. In tennis elbow, if you are doing exercises in tennis elbow, normal movement is like end range restricted movement. It's like end range restricted movement. If you do flexion, you can do till here or here only. You cannot do complete flexion of the elbow joint because it is little bit restricted over that single area, or end joint is restricted. It could be in flexion area, it could be in extension, or both the normal movement could be restricted. So first we have to do normal movement of the elbow joint, gentle flexion in gentle extension of the elbow joint. 5 times flexion and 5 times extension of the elbow joint. After that, we can do normal supination, pronation of the elbow joint. Supination, pronation, or you can say a key movement of the elbow joint. 1, 2, 3, 4, 5. It could be restricted on end level, so it's not necessary to do complete. Just do normal movement with keyhole movement like this. After that first icing, second we have done normal movement of the elbow joint. Third, we will do all register movement or strength movement with the stretches. In resistance movement, we can use 1 kg dumbbell. In normal resistance movement, we can use 1 kg dumbbell, or we can use a water bottle of 500 ml or 1 liter with the gripping movement of the elbow. First, what we have done, first was the icing. After that, we have done normal flexion and extension of the elbow joint. Then normal key movement of the elbow. That was the warm-up part of the elbow rehab. Now we will move to the second stage, which is resistance training of the elbow joint. In resistance training, we have to see one thing, that we are able to hold the object or not, we are able to hold the weights or not. Otherwise, we can do without weights also. If the patient is able to hold 1 kg dumbbell or 1 kg weight in that hand, then it's fine. Otherwise, normally we can do with empty handed like this also. So first, we have to assess our capability, our strength on the elbow. Otherwise, don't move directly to the resistance training. But resistance training is always indicated and very important part of the elbow rehabilitation. Now, in this, what we are using is 1 kg dumbbell. We are using 1 kg dumbbell. We will do all the movement of the elbow joint with 1 kg dumbbell. The movements are of wrist joint, but it arises from the elbow joint. So you have to understand that thing, that I am doing the movement of the elbow joint, but it is related to the I am doing the movement of the wrist joint, but it is related to the elbow joint. Now, what I am doing is gentle movement of the wrist joint and hold it. You can do with the water bottle also at home. Gentle movement and hold till 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is single cycle of the elbow joint resistance training. You have to watch it carefully because it's a systemic movement of the elbow joint. We are covering all the movement of the elbow joint together, including cure of elbow joint pain, which is related to the tenderness of the lateral side or tennis elbow, golfer's elbow, or bicipital tendinitis. The movement is, again, I'll explain you the movement. 1, 2, then rotation, hold. In this rotation, we have to hold 3, 4, 5, then rotation down 6. We have done 6 movement with 10, 10, 10 second hold. In between, you do not need to rest your hand, just keep it in elevation. Again, we will start with this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotation, then hold. After that rotation, we have to maintain the gravity of that muscle. For increasing the strength of the muscle, we have to hold here also. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Two commonly made mistakes are don't do with both of the hands. We have to do with single hand only. If you are having tennis elbow on both of the side, then first do right, then do left. Don't do both of the hands together. And with the 10 seconds hold, we don't have to do like 1, 2, 3. It's a normal hold. Don't hold in a flickering way. It's a normal hold. Don't pressurize or don't give any thrust to the shoulder or the elbow joint because elbow joint is also very sensitive joint. So we have to maintain the complete collaboration of that joint, complete association of that joint at the local area also, including perception of the elbow joint. That was the first weight exercise for the elbow condition. First, I will give revise also. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Rotate down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These all are 6 steps total, which we have done with 1 kg. You can start with half kg, 500 grams also, or with a water bottle of 200 ml. That is also appropriate to get start with the elbow pain. This is indicated for all types of elbow joint pain. First was icing, which we have done. Second was normal movement of the elbow joint, including key movement. Second was that. Third was resistance exercise. So keep it in mind. We are not doing resistance exercise directly. That was on third number. First, we have done icing of that elbow joint. Second, we have done normal movement of the elbow joint. And third, we have done exercise with the weights. Fourth, we will do exercise with the therabinds. These all are the tubes or loops of different intensities. These are less in strength, these are more, and this is very much in strength. These are normal loops for exercise bands. We will use a yellow one here. In this, we are having basic movement of the elbow joint, all the movement of the elbow joint with the support. We have to fix like this. I have fixed like this. You can do with normal towel or no normal support of any cloth also, but cloth is not going to stretch. You can do with elastic support also, but don't overstretch it because it's really mild to do exercise, or you can order this online. We have to maintain like this. It's my shoulder level. It's my shoulder level. And this, we have to stretch outwards and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Leave. First exercise, the movement is going outwards. The movement is going outwards. It is also good for your shoulder pain, because what is the use of elbow joint exercise with wrist and shoulder is to strengthen all the compartment, including cervical joint. If you are doing exercise to the elbow joint, it means you are doing exercise to the shoulder and cervical spine also. And elbow joint is directly related to your shoulder and cervical spine. So it's really important to do exercise for your shoulder and for your cervical area pain also. First, we have done like this. Second, we have to do like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Very good. Third, that was in downside. Now it is going up, and this is going down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, very good. First, we have done like this. Second, we have done like this. Third, we have done like this. That was the third stage or 3 grade exercise of the theraband of the elbow joint. For that, you have to strengthen your wrist joint also, because strengthening of the wrist joint is very important to do exercise of the elbow joint. Now, we have done all the resistance exercise, basic resistance exercise. Now we will see the stretch and squeezing activities of the elbow joint. Please keep it in mind to do exercise after icing only, because we have seen so many patients doing exercises of the resistance directly, but don't do resistance exercises. Normal exercises you can do without icing also. Normal squeezing exercises or isometric exercise or gentle stretches you can do. Now we will do towel squeeze exercise of the elbow joint. You can take a normal towel and we will grip like this. The very important part is gripping of the towel in this exercise. So we will grip this towel like this. And first we have to grip, then we have to squeeze the towel, squeeze and hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. In this squeezing, we have to maintain our elbow joint in a straight way. I'm pressing this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was a squeezing movement of that towel. That is also a strength program of the elbow joint. Now, second exercise of the towel is again gripping the towel. After the proper gripping, we will squeeze it in a clockwise from right side. Very important thing which we have to understand in this, if we are doing this exercise, then we have to do movement in only single side, not opposite side. In a clockwise manner, if you are doing with the right hand, we are having tennis elbow on the right hand, so we have to do clockwise manner, clockwise movement from the right side. Hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Leave. We have to rotate, hold, and leave. We don't need to get it back like this, because if you do backwards movement of the elbow joint, it means you're doing stretching of the both compartment of the elbow joint. So that is why we have to understand things. Movement is only single side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That was the second towel exercise of the elbow joint. Now we will move to the third towel exercise of the elbow joint. Is like we were squeezing, we were pressing the towel, we were squeezing the towel, squeeze. First is press, then is squeeze. Now press with folded hand. Yes, like this. You can see 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. These are the basic three exercises of the elbow joint pain, including tennis elbow and golfer's elbow. Sometimes pain is not at the elbow joint. Pain arises from below the elbow joint and goes towards the wrist. This also could be tennis elbow pain or golfer's elbow pain without any neural involvement. We have to rule out, we have to check the neural involvement only. Otherwise, all the exercises are indicated. Next exercise is weight cuff exercise. You can do with water bottle also, like this. Empty water bottle, it's around 150 to 200 grams only. So you can do with water bottle also. After that, you can fill water from 1/4, then half, then 3/4, then full. This is also progressive resistance exercise. If you are going to progress, so you don't need to take so many dumbbells of half kg, 1 kg, 2 kg. Just start with that and start filling water at 1/4, half, 3/4, then full over the bottle. Now this is the weight cuff. We have started. We are going to start exercise with the weight cuff. Weight cuff we have to bind at our wrist area. I have tied that weight cuff my wrist joint. Now we will start exercise free movement to the elbow joint. In that free movement, in initial stage, you can start without weight cuff also, but with weight it is good to have strength. In this, we will start moving anti-clockwise, 10 wise to make a bigger circle from a smaller. Yes, I have done 10 repetition anti-clockwise, then clockwise from bigger to smaller. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You can feel the movement of the elbow and the shoulder also. You can feel the point pressure over that area also. So it is really important to understand that thing, that we have started this from anti-clockwise and we will move to the next step, which is clockwise. It was anti-clockwise. Again, I'll explain you. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Small to big. Small to big. After that, big to small. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. That is related to shoulder joint pain and elbow pain. Both of the pain are associated at that same area between that elbow or arm area. So it's really important to do this exercise. It was the first exercise of weight cuff. Now second exercise of weight cuff is in second exercise of weight cuff. You can do this exercise with weight cuff. You can do this exercise with dumbbell or 1 kg weight also. But I'm doing this with weight cuff. You just have to maintain a L shape. L shape. Yes. If you are using dumbbell, then you have to use like this, not like this. Yes, very good. Like this. Yes. Otherwise, what will happen? This will improve your side flexor compartment strength. And we have to improve overall strength of the elbow. So we have to maintain like this. In this, we will give a box to our ceiling in a smaller way to bigger way. Like this. First, we have to see. This is a really very helpful exercise for shoulder patients, including tennis elbow or golfer's elbow. The patients who are having frozen shoulder plus the strength or weakness in the elbow joint is gripping the elbow joint, wrist joint. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 10 movements are there. See the hand movement. The landing is the same. Landing is the same. We don't need to land on dipped side. We don't need to, yes, it's L shape. First, we have to check the starting position. This is the starting position. So in this starting position, we have to maintain like this. 1, 2, 3. You can do without weight also. First, do without weight. So if you'll do without it, then you can understand this exercise more comfortably. So I'm doing with this without weight. You have now more better background. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 10 is that center of that head area. That was the area of the 10. This is important for frozen shoulder also. Don't do like this. This is not indicated. This is elbow exercises. What you are learning here is only related to the elbow. We have done like this 1, 2, 3, 4, 5. There is no any hold. There is no hold exercise. That was the second exercise of weight cuff. Now, the third exercise of the weight cuff is keep that weight cuff in your hand like this and give a flickering movement. It's a flicker movement. Yes, like this. It is to strengthen your extensor and flexor compartment. Just give a flicker to that area. Flicker could be 10, 15, yes, very good, like this 10, 15, 20, 25, 30 max without any hold. The hold is not recommended in this exercise. Without any hold, we have to do like this 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. With the other hand, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, that was it. Yes. Now we have to understand the basic don'ts, basic things which we have to avoid in the elbow pain. One more exercise is left. In this exercise, we will use any rod or anything, any object which is in lengthened area. After the gripping with the both hand, we will try to break it. We will try to break it from center. First, we will squeeze from our hand, we will grip from our hand, normal rod or normal stand or normal lengthened thing which you can hold in your arm like this, hold in your wrist and try to break it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, try to break it. Yes, 1, 2. If you will do this exercise, you can feel the movement at the elbow joint. You can feel the movement at the elbow joint. You try to break it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, like this only. We have to see the precaution, or we have to see the don'ts of the elbow joint pain. First and very important is the holding the mobile phone. If you are holding mobile phone like this or this without any support, then it can increase your arm pain, including your tennis elbow. So if you are having tennis elbow, then you can use binder. I'll show you the binder and place of the binder, where to use that binder. That was the squeezing exercise of the towel. You can see the movement he's having on left side tennis elbow. In that left side tennis elbow, he's squeezing that clockwise from the left side tennis elbow protocol. After that, this is the elbow supporter. Very important thing in this, that patient is not wearing this elbow supporter at that elbow joint pain area, because at that joint pain area, the condyles are susceptible to that area inflammatory response. So to avoid that, we have used that at extensor compartment of the elbow joint. This is extensor compartment of the elbow joint where the binder has gripped of that patient. In this patient, we have gripped that elbow support. It is really normal strapping support. You don't need to use any rotation or silicone gel support to prevent any tennis elbow or to cure the pain of the tennis elbow, because it is using this to improve the strength or to restrict the movement or to give the support of the forearm compartment at the extensor. So we have to do like this only. This is a normal supporter of the elbow joint. In this normal supporter, we have to see one thing, that if we use that elbow area supporter, we have to, this is my elbow joint, I'm using over that area at forearm extensor compartment, the belly of that compartment. And this is 2 to 3 inches below at the joint level. This is 2 to 3 inches below at the joint area. Second and very important thing, sleeping posture. While you sleep, you don't need to press your hand like this, because if you will sleep with the complete flexion of the elbow with the head rotation, it will increase radiating pain from the shoulder to the elbow. So sleeping posture is again very important. And third important thing, first was holding the mobile phone holding, second was sleeping posture, and third is touching that area. Don't need to touch the pain area, because if you touch that area, it will get more inflamed over that area. So you don't need to touch this area, because this area is in that elbow joint. We are having condyles moving towards inside and towards outside. So if you are having pain at that area, you can dislocate the elbow joint by pressing, or you can do any wrong maneuver with the touching perception. So you don't need to touch that area. These are the three important things to see in the elbow pain. Now we can move to our question answer session.
Yes. Hello, doctor. Thank you for a clearly explained session. Two questions. Yes. Some of those exercises you did at the beginning with the wrist, the weight and the towel and etc. If you've got osteoarthritis in your wrist, is it good to do them? Will it strengthen the wrist, or you shouldn't do them?
Yes, first you have to do normal icing, ice fermentation over that area. Second is normal movement of the elbow joint, which is warm-up procedure. Then you can move with the weight. You can do with 1 kg. Yes, you can do.
So flexing the wrist is okay if you've got osteoarthritis?
Yes. Flexion of the wrist is okay. With even resistance is okay. And with even TheraBand is also fine. So with TheraBand or resistance tube, you can do all types of movement easily. There is no contraindication, because TheraBand and the resistance bands are adjustable. So the strength which you are having in your wrist and elbow, only that will get stretched. Otherwise, the overstretching is not applicable to the osteoarthritic patient. So it is completely safe.
Okay, so it could help the wrist as well? It could help strengthen the wrist?
Yes. We have taken that topic only to understand the basic pain of the elbow, but it is related to the shoulder and the wrist joint pain also. If you do the exercise of the elbow, then automatically you will get complete strengthening of the wrist joint.
Okay, and then finally, you mentioned this exercises for pain. Can we use them as prevention as well, or no? Just to use
Yes. We can use for the prevention, but for the prevention we have to move gradually from the 1 kg, because if you'll get stable on the 1 kg weight, you cannot get complete strength. And if you are not having any pathology, then you should move to 1 to 1.5 to 2.5 kg of the weight for maintaining strength of that particular joint.
Right. Okay. Thank you.
Most welcome.
I just wanted to ask you something, doctor.
Yeah.
No, I've got a
Yes.
pain here. It's it's got really worse in the past week. I don't know what more to do. I've been massaging it. I've been doing all these exercises for it. What else
There's
can I?
the-
I've
I
had 3
cannot-
injections already. I've already had 3 injections. I don't know if you can see me.
I'm not able to see your pain
No?
area.
Where?
Yeah.
I don't know why I can't see myself there, so I don't know. But it is just under the thumb and just above the wrist.
This area,
Yeah. Yes.
this area,
Yeah.
it is related to dequerens. It's in dequerent tenosynovitis. It's in tendon over here, which starts
Here,
from
here,
the wrist.
here.
Yes,
Okay,
it's
see me now.
yes, it's the wrist joint.
This
Yes,
one.
yes. You can do icing. You can do icing, or you can apply any anti-inflammatory ointment plus
Yeah.
crepe bandage. There is an spica which is known as thumb spica. Thumb binder, you can say. You can search it on Google. It's thumb spica. THUMB SPICA. Spica. Thumb spica. It's not thumb spica.
I'm
It's a
using
normal
that
wrist
and
binder.
that. I'm using that and that, which helps.
These all are not indicated for the thumb pain because you are having pain from here to the thumb.
Here.
Yes, so you have to immobilize the thumb. Thumb spike is like this, in which thumb will get erect and stable. So you have to use thumb spica with the ointment and don't massage it. Massage is completely contraindicated in this case. If you're going to pressure it or you're going to massage it, then you have to take any steroid shot.
I've had already 3 now. They've said surgery. I don't want to have surgery.
No, there is no need of any surgery.
No. But it
Just
started
use
in the other hand as
spica.
well now. It started in the other hand as well. So I
Yes,
don't
yes.
know.
It could be carpal tunnel syndrome also.
They haven't said that, but okay, thank you. Thank you.
Welcome.
Yes, I have a question. I get pain on the...
Mayuriji, just a minute. Vasuji is raising hand for a little while.
Yeah.
Vasuji.
Yeah, I have this pain. Can you see? I just got put my video on. I have a
Yes.
pain on the, and they said it is and they gave me injection. It's just there. I can't. It's very very painful, and
Yes, yes.
I don't know what to do with this. Now they want me to give an injection for steroid on April, which I don't want to go for.
There is
what-
no need to take, and there is no need to take a steroid shot over that area. This is also the same which we have seen in earlier case. This is dequerens tenosynovitis, the tendon which get inflamed over here. For that, we have to do first and very important immobilization of the thumb. You have to maintain the movement of the thumb. If you can maintain the movement of the thumb, then you can achieve a good cure of that particular disease. So you have to use thumb spica first.
How do I do
Wrist
that?
binder is a different thing.
I can do that, but I can do this, but it's just painful. See, I can do all that movement, but
Yes.
the pain is there.
Movement is there, but if you will stretch it more inside or you will stretch it like this, you will get
Yeah.
pain.
Yeah.
Yes, this is overstretching pain of that tendon particular. So you
Yeah.
have to maintain in a thumb spica. You can write down thumb spica and thumb spica. With that thumb spica, you will get immobilized of the thumb. After the immobilization of the thumb, 1 week or 2 weeks, you can do all the things, all the chores at your home.
So how do I have to do that? Somewhere else?
It's in binder. It's in supporter which you can buy from market, which you can
Yeah.
buy online. This is thumb spica. You have to
Yeah.
maintain your thumb like this because
Yeah. Okay.
if you will stretch your thumb like this again and again, the tendon
Yeah.
will get inflamed and the steroid shot will also not going to help you.
Okay.
So
So
you
I have to
maintain.
hold. I have to
Yes.
have by to keep it folded like that.
Yes, like
Yeah, okay.
this first and icing.
Icing. Okay. Thank you very much, doctor. Thank you.
Most
God bless you. Thank you.
Welcome. Thank you. Thank you.
Thank you.
Yeah. Yes.
I've got pain on the outer side and the central side, and it's all because of the neck, degenerative spine, cervical spine, and trapped nerves. So what would be the best thing for me to do?
It's good for you to do all the elbow exercises without weight, normal weight. You can start with the normal weight first. Do the icing of the elbow plus shoulder area also. First,
Yeah.
do icing. First, do icing of the shoulder and the elbow area.
Yes.
Second, do all the wrist movement exercise, normal elbow movement exercise. Then you have to do cervical and shoulder regime in a combination way.
Combination way. Are you able to show me one of
Yes,
those?
yes, yes. We have seen normal isometric of the cervical spine 1, 2, 3, and 4.
Yeah.
First
Yeah.
was that. Second, the shoulder movement with that stretch. In last class, we have seen the normal thoracic extension stretch of the wall like this.
Yeah. Yes.
We were pressing shoulder and
Yes.
head. It was the combined movement of the shoulder and the cervical spine. You
Okay.
can do like this. And in any cervical radiculopathy, in any shoulder pain, you have to move systematically. You have to strengthen your cervical spine first, then shoulder. Shoulder is a major compartment. It will take 1 to 2 months. Then elbow or wrist joint. Not directly move to the elbow joint or wrist joint.
Cervical, shoulder, and
Cervical, shoulder, then elbow and wrist.
elbow and wrist. Okay. Because I was doing some exercises for carpal tunnel. I went to a physiotherapist.
Yes,
and,
yes, yes.
And it did
For,
help.
for carpal tunnel also, you can get help from the TheraBand exercises because it's more over on a strength exercise. If you do strengthening exercise of the elbow joint, you can get strength over here also. So it's preventive exercises also.
Yes. And I should not use weight, you said.
Yes, you should not use weight.
Because
and
of the
holding your
cervical.
mobile phone.
Mm.
Holding your mobile phone holding this much flexion is good. This is not good. If you do like this is not good. You have to maintain this. For CTS and carpal tunnel syndrome, what will happen? There are a few bones over that area in
Yes.
which that nerve crosses to the supply finger. If you will do overextension or overflexion of the wrist joint with the holding movement, then you may get suffer from tingling sensation also. So you have to maintain that flexion. Use your mobile phone like this. Then use your mobile like this. This is without flexion, not like this.
Can't see you.
Not like this only.
Can't see you.
And here only.
Yes.
Now can you see?
Yes.
You have to use like this only, not like this. If I'm using like this is not indicated, this is not indicated, this is not indicated, this is indicated. A normal movement of the wrist and the elbow joint.
Yeah. Okay.
Yes, like this.
Yes. And I also get lots of pins and needles in both my arms going to the fingers.
Yes, it could be grade 2 or grade 3 CTS. So you have to prevent it first, then move on the curative content of that particular problem.
Okay, fine.
Thank you, Dr. Deepesh, and thank you, everybody. I'm conscious of time as always, so thank you again for joining us. I'll share the recordings, and we all see you next week. Do not forget to write your question if you have any on the group, and we always address this. Thank you, everybody. Thank you,
Thank
Doctor.
you.
Thank you very much. Thank you.
Thank
Thank you. It was good.